my name's Kayla. Welcome to your Diastasis Recti assessment. I'm going to first show you how to do the assessment in a standing position, because once I get lying down for the proper assessment, it's going to be a little bit more challenging to see the hand positioning once I'm lying down. So that's what I'm going to demonstrate standing. One thing I do want to point out is diastasis recti is not caused from pregnancy, and it does not only affect women. Diastasis recti, which is the abdominal separation between your right and left halves, essentially creating space between in the linea alba, so that center part of the abdomen. It can be caused by a number of different reasons, and it affects both men and women. So if you feel that you might have an abdominal separation, whether you've experienced pregnancy or not, and you're wanting to do this assessment, it's a great place to double check if you have any abdominal separation. Also, technical separation of diastasis recti is measured by 2.7 millimeters, and that averages out to be almost about 2 fingers width of space. So to get a official diagnosis, that is the measurement they are looking for. So you're going to take your fingers at your belly button, and then essentially you're going to be finding some downward pressure, and it's pretty noticeable. You're going to feel if you have almost like a hole, like you are going to be able to push your fingers like straight down and through the center of your abdomen. If you're unsure, you're not feeling something there when we do this lying down, then you probably don't have the abdominal separation. And if you do, it might be very minor to the point where you can't always feel it. So like I said, we're gonna be pushing down. We're gonna start from the belly button, and then we're gonna go down, and then we can also check up as well. So it doesn't just happen into the lower part of the abdomen. You can have a separation in the upper part of the abdomen. Also, when we're in our reclined position and we're doing that downward pressure, feeling for that gaping, you're gonna begin to lift your head. We want to be mindful that we're not lifting the shoulder blades and coming into a crunch. So it's just a lifting of the head once we're on our back. So let's go ahead and practice that. Find yourself lying down on your back. Feet are just gently planted, hip width distance apart. I'm going to take those fingers in a downward motion, starting from the belly button. You're going to begin to lift just your head up, and you're going to start to push down and out. And notice, do you have any gaping all the way down into your pubic bone? Now again, be careful that we're not lifting the shoulder blades up. So we don't want to feel those tummy muscles flex right now. We want to feel them kind of almost soft and squishy. So as those fingers are kind of digging down and out, you should be noticing, and then go back up to the belly button and then go up towards your sternum. You should be noticing if there is a noticeable space or separation where your fingers almost go straight down, and then you should be able to almost push out. And then that is going to indicate if you have diastasis recti. And it might be that severe case where it would technically be diagnosable and bring you to a physical therapist. You'd probably get a recommendation. But if not, and you're still feeling some separation there, this is a great place for you to kind of pull back the reins a little bit and start to work on healing that with some breath work. So I have a diastasis recti basics class, which is going to start with a lot of foundations work. So I'd recommend viewing that class after you've done this assessment.